So for anyone with a cervix out there, for us to screen for cervical cancer, we have to obtain our specimen or our sample from your cervix. For you to be screened for cervical cancer, we have to obtain our specimen or sample from your cervix. So how do we obtain our sample or our specimen from your cervix? We mentioned earlier about the screening test. We talked about the cervical screening test, that is the pap test or the pap smear, which is used to detect any abnormality in the cells of the cervix. We also talked about the HPV screening tests, that is the DNA probe for HPV, and also we talked about the PCR for HPV. So for us to screen for cervical cancer, we have to obtain our specimen from your cervix. And I'm going to show you how we are going to obtain our specimen from your cervix. Hello guys, hope you are doing fine. Welcome to our channel. This is your channel, and I'm welcoming you to the third episode of this cancer series, Hadi Tamati. Now, this is how we obtain the specimen or the sample from the cervix. Once you come to our private room, or once you come to our room, or we call it the examination room, you are required to undress, that is to remove your clothes, and we say the waist down. So you are required to just undress, utoe nguo zako zote. And when you are coming for cervical screening, you are not required kuvaa kijeshi kama mtu anaenda kwa vita. So you are just required to uvae light, and then you are required to undress your clothes from your waist down, so that daktari anaweza angalia mahala pale. Sawa sawa. Then you will be required to lie on the examination bed, or you can just call it the examination table, on your back. So you are required to lie down on your back with your knees bent, and the heels supporting your knees. Sawa sawa. So ni kumaanisha unalala kwa mgongo, and then your knees zikuwe juu, then your heels to support the other part of the leg, that's the knees, na you support the other parts of the leg. Sawa sawa. And then during this exercise, you are just required to not interlock your legs, kwa sababu we need to obtain that cervical specimen from your cervix. Sawa sawa. So you are not required to interlock your legs. So in Kiswahili, or for lack of a better Swahili word, ni unapanua miguu. Sawa sawa. Then after you've done that, your healthcare provider will insert a certain equipment known as a spectrum or a speculum. That is, speculum is an apparatus or an instrument that is used to do what? To hold the walls of your vagina, so that your healthcare provider can see the cervix, ama aone mahali ambapo ataweza kutoa ile specimen pale. So the speculum ni chombo fulani ama ni apparatus fulani ambayo inasaidia daktari kushika the walls of your vagina, yeah? It holds the walls of your vagina, so that the doctor or the healthcare provider can just access your cervix na aweze kutoa ile specimen ama ile cells pale. Sawa. Now, with the aid of using an highly spatula and using a brush, then your healthcare provider sasa atafanya nini? Ataweza kuingia pale kwenye ile cervix, aweze kuswab kabisa zile cells kwenye ile cervix, and once ametoa zile cells kwenye ile cervix, those cells can be transferred to a glass slide, taken to the lab for staining and examination, ama zile cells ambazo ametoa kwenye ile cervix pale anaweza ziweka kwa certain liquid preservative ambayo ina preserve hizi cells, na hata kale ka brush kanaachwa ndani, so that the lab guys will make themselves a smear, na pia watafanya the HPV testing na watatupatia matokeo. So once the specimen has been collected from your cervix, then now you are required to move around and proceed with your daily activities. Yeah, so that is how we get the cervical specimen or the cells from your cervix. Yeah, so the cells now have been taken to the lab for processing. Before you are removed, or before we remove the specimen from your cervix, you need to prepare. Kuna zile preparation methods ambazo unafaa ukuwe aware before that specimen is taken. Number one, you are required to avoid or abstain from sexual intercourse at least 2 days before the test. Yeah, usikuwe na mechi, don't schedule mechi at least 2 days to the test. Sawa. Number 2, avoid using what we call vaginal medication. Kuna wale ambao wanatumia dawa fulani wana insert kule chini, so avoid using this vaginal medication kwa sababu they alter the pH of the vagina na zita cause masking of the abnormal cells of your cervix, so hatutaweza kuona any abnormality. Sawa. So avoid dodging. Dodging is the cleaning or let's say the cleaning the inside of your vagina using perfumed soaps such as Dettol, Geisha. So you are not required to wash the inside of your vagina using these perfumed soaps. Unajua kuna watu ambao wanatumia hizi masabuni ili waoshe ndani kwao ili labda by the way, it's not right. Dodging is not right because dodging causes what we call an imbalance in the cells of the cervix. I mean it causes an imbalance in the bacteria in your vagina na inaweza kuletea madhara mingi than good. Yeah, the system of your body has got its own natural cleaning mechanism and that's by secretion of fluids. Mwili iko na njia zake za kujisafisha, so you are not required to wash your vagina with those perfumed soaps. Itakuletea shida, and by the way, if you dodge, you wash away those cells of the cervix which are of interest in cervical screening, hence hatutakuwa tumekusaidia. Yeah, so avoid using spermicidal creams or foams. Unajua kuna wale watu ambao wanatumia creams fulani pale ambazo zinatumika kuua sperms. Hizi creams huwa zinaua sperms. Kama mtu anatarajia kufanya mechi pale na ametumia hii foam, hii cream itaua zile sperms. So if you use these creams or foams before the test, it interfere na pH pale and it will mask those abnormal cells ambazo tunafaa tuziangalie tuone kama uko na abnormality ama hakuna. Sawa. Then number 5, you should not schedule a pap test when you are menstruating. Sawa. So if you know unanyesha, that period is not right for you to have a cervical screening. Sawa. Hiyo sio time nzuri ya kufanyiwa cervical screening kwa sababu already uko na tone za damu. Hizi tone za damu zitaosha the abnormal cells na pia itaosha hizi cells ambazo are of interest. So it is not right for you to schedule a pap test when you are menstruating. Sawa. Now, screening is the first step in altering the development of the cancer cells in your cervix. So screening ni step 2 ya kwanza. In other words, the magic of beating any type of cancer, be it cervical cancer, be it prostate cancer, be it any type of cancer, is screening. So early screening and detection will aid in diagnosis and treatment of cervical cancer. Sawa. And the ladies or the women with a cervix wale ambao tunapima ama tuna screen for cervical cancer, they should be 25 years of age and above. So if you are 25 years of age and above, tunaweza fanya nini? You can be screened for cervical cancer, and it is usually done after every 3 years unless your pathologist requests that the pap test be repeated at least annually ama yearly. Sawa. Unless your pathologist ama request kwamba rudiliwe hiyo test yearly, hapo sasa ndipo utakuwa unaweza fanyiwa routine. Unaweza kuwa unafanyiwa pap as a routine test yearly. Sawa. Yeah. And if you are battling HIV, unafaa kabisa uangaliwe for HPV and also the screening for cervical cancer because already your immune system is compromised na so kupata HPV itakuwa ni haraka. And we said that HPV group 16 and 18, these are now the viruses or the group or the types of viruses that cause what we call cervical, are the ones that causes cervical cancer. Sawa. So if you are experiencing painful micturition, hiyo ni wakati unasikia uchungu ukikojoa. If you are experiencing what we call painful sexual intercourse, wakati umeenda mechi na mtu wako pale unasikia uchungu akifanya mambo yake pale. If you are experiencing what we call vaginal discharge which is abnormal and which has a foul smell. If you are experiencing what we call a vaginal bleeding in between periods, hapo katikati umenyesha date 1, 2, 3, alafu tena unanyesha 13, 14, 15 of the month. If you are experiencing vaginal bleeding after menopause, wewe umemaliza kuzaa na bado unaona tone za damu. If you are experiencing vaginal bleeding after sexual intercourse, wakati umefanya mechi yako pale, then kindly consider screening for cervical cancer. And we've said the screening methods, tuko na pap test, that is pap smear, na tuko na HPV screening, na tumesema hapo tuko na DNA probe, alafu na pia tumesema tuko na PCR for HPV. So who are these people who should not be screened for cervical cancer? So who are these individuals who should not be screened for cervical cancer? Number one, we've got people with what we call, who have undergone a certain procedure we call hysterectomy. Hysterectomy is a surgical procedure ambapo mtu anatolewa the womb ama anatolewa the uterus. Yeah? So kama if you have undergone that sterile surgical procedure ambapo unatolewa womb ama your uterus, then there's no need of you having what we call a cervical screening, because we say the cervix, this is the lower part of your uterus or womb that connects your vagina. Sawa sawa. So if you have undergone that process na una womb, una uterus, then there's no need of you having what we call the cervical screening done to you. Number two, if you have obtained or you are 65 years of age and above, and the previous cancer or pap tests are negative, there is no need of you continuing doing what we call the cervical screening, because the other tests are already negative. The other, what we call the cervical screening, that is the HPV and the pap test are negative, then there's no need of you being screened for cervical cancer. So we've obtained our specimen, and this specimen, you said it can be conventional pap, or we can do liquid-based pap test. Conventional pap ni wali ambapo when your healthcare provider ametoa ile specimen pale kwa cervix na anaiweka kwa glass slide, hii ndio tunaita conventional pap. Hii sample itaenda kwa lab, it will be stained, alafu sasa itakaa examined under microscope. Sawa sawa. Then we've got what we call now liquid-based pap test. Hii ni ile ambapo tumesema sample zako, yule daktari ama yule mhudumu anatoa zile seli kwenye cervix yako na anaziweka kwa liquid fulani ambayo ni preservatives. So this liquid preservative, na bado na ile ka brush ambayo tulitumia kutoa zile specimen inaachwa kwenye hiyo preservative. So hii liquid inapelekwa mahabara, ambapo wale watu wa mahabara wanajitengenezea specimen, wanajiundia hiyo smear yao, wanaweza fanya pia HPV so that they can screen for any abnormalities in the cells of your cervix. Sawa sawa. Sawa sawa. So the next question now is, what do you expect after your specimen has gone to the lab? Yeah? What do you expect? What does a positive HPV imply? Yeah? A positive HPV na imply nini? What is the staging of cervical cancer? Utaniambia aje niko na abnormality kwa cervix yangu, ama utaniambia what stage is it, ama imecause, ama is it spread, ama iko wapi? So these and many more questions in our next subsequent episodes. So guys, don't miss our subsequent episodes. Thanks for watching. Kindly like, subscribe, share, follow. Till next time guys. Bye. Thanks for watching.